And his cases are not simple. He gets urethroplasties from all over the countries. He has got a series. Probably he is the largest urethroplasty surgeon in the world now. He has replaced Barbegli as the #1 surgeon. He has got innovative techniques. He develops techniques in such a way that he can present them. Plus, second thing, he is known as the workshop Kulkarni. He organizes workshops every month, and they are almost free, and delegates from all over the country as well as abroad attend his workshops and learn a lot from him. He is a super person. As a person also, he is very good. Thank you, sir.
Thank you, Dr. Ajay Gupta, very close friend of mine for many years, and we are the founder members of Medipoint Hospital. We started about 25 years ago. Marathi सांगतो, बिबरे सर, राजेश देशपांडे, पद्मनाभ केसकर. मी 25 वर्ष किंवा 35 वर्ष जवळजवळ कोथरूडमध्ये प्रॅक्टिस केली, पण मी बाणेरमध्ये आल्यानंतर मला घरी आल्यासारखं वाटतंय. म्हणजे एखादा मला परवा असा एक पेशंट आला होता, सुपर VIP, आणि त्याला स्किन स्पेशलिस्ट मला पाहिजे होता. राजेश देशपांडेंनी मला 2 मिनिटं सांगितलं की मॅडमला बोलवा. मॅडम आल्या, त्यांनी आमच्या पेशंटला बरं केलं. तर हे बाणेरमध्ये फार सुसह्य आहे. कुठलाही स्पेशलिस्ट मिळू शकतो. आज आपण गेले 2 दिवस जे बघितलं ना, मला असं वाटलं की साला जगातले सगळे टॉप डॉक्टर्स बाणेरमध्ये बरेच काय. तर आता सगळ्यांना पुढचा स्टेप काय आहे, बाणेरच्या पुढे जाऊन वर्ल्ड फेमस व्हायचं आहे. कसं करायचं? So I was president of Society International Urology. I'm only the second person in India to chair this worldwide association. Every doctor can have 3 jobs: provide service to the society. We see patients, we give the medication, and we do surgery. That's service to the society. Teaching. Some of us are teachers, and we create the next generation of doctors. Lastly, research and innovation, which I have put at the top, and that's rarely performed by doctors. So what are the attributes of a surgeon or a good cardiologist who is skillful, or a doctor? First of all, who is invited to give talks? You have a great personality like Dr. Benny. I like him. You are a great orator like Dr. Prasad Bivre. He can carry the audience with him. Fantastic surgical skills, because you are invited to perform surgery, demonstrate surgery. You are a popular teacher. You have invented a new operation. You have written lots of papers. You have authored lots of books. You have traveled around the world to teach. And most important, recognition from peers. That means your colleagues and seniors appreciate that you are a good specialist in that. So this is Steve Jobs. What he says is that innovation distinguishes between a leader and a follower. We know that Apple invented and Samsung is following. Samsung can copy but cannot be Apple. I'll give you tips of how to invent. There is a problem, complex problem, not simple. What are the solutions? You go to the books, read journals, go to YouTube, go to different online methods, and then you have a solution. Then you start thinking that you are the patient. Are you willing to undergo the same surgery? Many times the answer is no. I have 2 urology colleagues sitting here. India, we have about 5,000 urologists. I always want to tease them, how many urologists undergo TURP? Dr. Bhalerao, do you know anybody? No. You understand? So what happens? What about PCNL? A urologist, I will tell you, will never in his life undergo a PCNL, but he wants to do it every day on a patient. So what we advocate to the patient, we are not willing to do on ourselves. You are the patient, you don't want that surgery. So that's invention. This is how you invent. I presented this, my job is to have interesting topics and talks. This is American Urological Association meeting in Chicago a few years ago. And the topic is, if we all follow guidelines, then who will invent? So we have to break the guidelines. And I presented five publications of innovations which are accepted worldwide. Coming to my topic of choice today, urethral stricture. Stricture urethra is common around the world, and it has been there for the last 5,000 years. And the treatment was dilatation. And then various surgeries came in last 100 years. When I was a surgical resident at KM Hospital in Pune, 1977 to 79, in the evening we had two emergencies. Injection abscesses, because the general practitioners were using boiled syringes, and we have an abscess here, there, and we used to make incisions. And second is urethral dilatation for stricture of the urethra. These patients came regularly on a minor roti. The patient is lying with legs apart. There is a whole towel around his genitals, and there is a kidney tray full of urine and blood. The patient is shivering, and this was a situation which went on for many years. And it is still happening in some parts of the world. From 81 to 86, me and my wife, Dr. Josna, went to England for urology training, because at that time in Western India, there is no MCH or DNB program. The programs are only in Delhi, Vellore, and Chennai. So I got a chance to work with Richard Turner-Warwick, considered father of urethroplasty. Then I met Dr. Guido Barbagli, who is considered one of the foremost authorities on urethral stricture, and he became my mentor. I want to tell you, even in middle of your career, you need a mentor. Even Sachin Tendulkar, Roger Federer need a mentor. They have to tell them how to improve your shots. So Guido asked me, Sanjay, what's your interest? I said urethroplasty and laparoscopy. This is about 20 years ago. He said, forget about laparoscopy and concentrate on urethroplasty. So I gave up laparoscopy. It's very difficult for you to give up part of urology in which you are interested. So I developed this what called Kulkarni technique of urethroplasty, presented a video in AUA 2000. So this is on the right, you can see this patient has a pan-urethral stricture, penile and bulbar urethra. I made a perineal incision, inverted the penis into perineum, mobilized the urethra on one side, and applied 2 buccal mucosa grafts. And once your surgery is finished, you pull the penis up, there is no incision on the penis. So this is the most popular technique of urethroplasty for penile, for pan-urethral stricture, and is published in the American textbook of surgery here, Hinman's Atlas of Urology. From innovation, so suppose you invent a new operation today. It's a rare operation. So to collect series, it takes some time. It doesn't happen that you have 10 cases today. Then to follow them up, then to publish. So this process of innovation to acceptance by American Urology Association, the process is long, may take about 20 years. Me and my wife, we opened Kulkarni Neurosurgery Institute in 1995 in Kothurud. Our parents inaugurated it. What happens, there are 115 urologists in Pune, 5,000 in India. We call it jack of all trades and master of none. We are all intelligent and skillful, but we don't dedicate it to a single disease and single organ. What is important for us to understand, then average urologist in Pune goes around in 1, 2, 3, 4 hospitals. He doesn't stick to one hospital. So there are no records. There is no follow-up. This is a true fact. So they say either you publish or you perish. Suppose somebody has done 10,000 surgeries, not published, not done. Very important. What you should do, read about your topic of choice for 1 hour every day. You must know what happened in the past, what is happening today, so you can predict the future. You must know all the papers published in the literature on the subject. So my teasers are usually, I will give you 2 teasers. What is the meaning of word doctor? Any answer? Meaning of the word doctor. We are all doctors.
Teacher.
Healer.
Teacher.
Yeah, Anand is correct. Meaning of doctor is teacher. Second teaser is, how do you measure size of your glove? Any surgeon who is wearing gloves and knows how to measure size of your glove? So in 2010, we started this monthly free urethroplasty workshops. This is our first workshop. On a Saturday, Sunday, about 8 to 10 urologists come inside the theater. On my right shoulder is a camera on a tripod. There is a 65-inch 4K OLED TV, and we discuss the cases. And if you go around the world today, this is not ego, but if you go around the world today, anywhere, and ask a reconstructive urologist where he learned or refined his technique of urethroplasty, he came to Eurocul Hospital, Pune, India. Next step is you have to compare yourself with the best in the world. So what happens? You invite the best people in the world. In the center we have Professor Mandi from England, Barbegli on the right side, and allow them to do surgery. And you perform surgery with them and allow the delegates to decide whether you are good or not good. There is no gray zone. Either you are good or no good. So we conducted urethroplasty workshops around the country in almost all states, all state capitals, medical colleges. Presentations and travel, surgery in 50 countries, and presentations in 10 more. So I have traveled to 60 countries. Most important, Germans, Italians, Spanish, Portuguese, English, they don't invite us to give a talk, leave aside teaching them how to do surgery. So I have done surgery in Germany many times. I recently went to Angola, traveled around the world. I just want to show you the number of cases I have treated in 3 days. Except one patient here, all had road traffic accident, fracture pelvis, rupture urethra, and they had a suprapubic catheter for 3, 5, 10 and 20 years. And the first time in their life, they will be passing urine normally per urethra. So however great a single person is, a single person cannot be head of a department. You have to have colleagues, you have to keep them professionally, financially happy. More the merrier. I want to have the largest department of urology in the country one day. Today we have 8 full-time urologists, single disease, single organ. We have a urologist for prostate, for stone, for urethra, for female urology. One person doesn't do anything, everything else. Most important, all fingers are not same. So we need all kinds of colleagues in the department. Some are very good, some are average, some are below average, but we have to carry everyone. What is an academic unit? A large volume of patients, experienced teachers, training, discuss, observe, assist, publications, workshops, live surgery webcasts, and WhatsApp group discussions. We started International Society of Reconstructive Urology and started a new journal from Pune. So this is a very important paper. One of my fellows, Indonesia, only 2 figures. Before coming to us, his success rate of urethroplasty was 64%. After visiting us, his success rate went to 89 or 90%. We have fellows trained around the globe, fellows, my own fellows who stayed in Pune for 1 year. And these are international urologists who visit us occasionally. My contribution is, these are the books, 1, 2, 3. Most important is, everybody knows Love and Bailey, the most popular surgery textbook in the world, and I have a chapter in that. This is the most important recognition the government of India can give the highest award to a doctor, BC Award from the President of India. I took my mom to Rashtrapati Bhavan. This is the greatest joy in your life. These are award list, hundreds of them. Honorary FRCS London, honorary member of British Urology, Australian Urology, African Urology, and now European Urology. This is the Felix Guillaume Medal from Society International Urology. This is for outstanding contribution to urology around the world. I've been a visiting professor to America in around 20 universities. You can see me and my wife visiting the Mayo Clinic, the #1 hospital in the world. I was there as visiting professor for 2 days. This is Society International of Genital Reconstructive Surgeons, and I got the Lifetime Achievement Award. So our Prime Minister says he is a Pradhan Sevak. So I'm also Samaj Sevak, and the contribution is recognized by what you can say other Sevaks of the country. So most important is we developed this Euroco Urology Institute, and it's the #1 center in the world today. Lastly, I want to say thank you to my life partner, Dr. Josna. He is considered mother of laparoscopic surgery in India because she started laparoscopy in India, second surgeon in India, first female surgeon in the world to perform laparoscopy gallbladder surgery, and now she is the robotic surgeon. So the journey started in Kothurud and now ended in Baner, and it's a legacy to have a 100-bed urology hospital, only third of its kind in the country. So thank you very much.
Thank you, Kulkarni sir, for an insightful and very inspiring lecture. I want to say 2 lines for Kulkarni.